getting a lot of guests, so I'm going to begin. Welcome, everybody. Thank you so much for joining the connection between oral health and overall health. My name is Bryce, and I work with the American Heart Association, and I'm very excited to have Delta Dental, our wonderful partner, presenting this session on the connection between overall health and oral health. I'm going to begin sharing my screen now, and then I'm going to introduce Dr. Tracy Dantzler, who is our lovely presenter today. She is a dentist, and I have seen this presentation. It is phenomenal, and you all are going to love it. So give me 1 second to start sharing, and I will kick it over to Dr. Dantzler.
Well, thank you so much, Bryce. There, I'm with the American Heart Association. I'm so happy that you're joining me today. I'm always excited when people are interested in their oral health. And so today I want to talk about a subject that's really important to me, and that is the connection between our oral, when we say oral, we mean mouth, the health of our mouth, and how it impacts our physical bodies or our overall health, systemic diseases. We're finding in dentistry, or actually we've known now for a long time, that there is an intimate connection between our mouth and our body, which only makes sense. Our mouth is a part of the body, but a lot of people compartmentalize dentistry. I like to look at dentistry as being somewhat of a specialty in medicine. We have to know everything about the body when we're learning about dentistry, and it's because anything that we do and anything that happens in our mouth is going to impact our body, and any processes, disease processes that occur in our bodies is going to ultimately manifest in one way or another in our mouth. So just to tell you, this next slide, please. A little bit about myself. I am the former president of the Genesee District Dental Society. I served on the board of directors for the Genesee District Society for 8 years. I'm a native of Flint, Michigan. And I completed my undergraduate studies at the University of Michigan in Ann Arbor, and I obtained my Doctor of Dental Surgery degree from Northwestern University Dental School in 1988. It seems like a long time ago. It's making me feel really old. I probably should leave that out of my biography. But I also received a certificate for Christian counseling from Mount Zion Church Beecher Institute, their Bible study, their Bible school. I'm a member of the American Dental Association, the Michigan Dental Association, and the Genesee District Dental Society. I'm also a fellow of the International College of Dentists, the American College of Dentists, and recently at the American Dental Association annual conference in New Orleans, I was inducted into the Pierre Fauchard Academy. It was a great honor. It's a global dental honor society, and less than 6% of dentists are accepted, and it's truly an honor. I love my profession. I'm no longer practicing. I stopped practicing in 2019 when I started working as a consultant for Delta Dental, and a couple of years ago I was blessed and very honored to be asked to become utilization management director. So I went from being an independent contractor to now working for Delta Dental. I was able to see all the phenomenal things the company does, and it's just an honor to be a part of it. So once again, thank you for having me today. That was next. So, today I'm going to talk to you about that connection between oral health and overall health. And there's so much to unwrap here. I mean, I had to keep condensing this talk so that I wouldn't go on for too long because there's just a lot to cover. And so I decided that, instead I would discuss, 3 of the main dental issues that I saw in my practice and that we see in dentistry, which is periodontal disease, cancer of the head and neck, and dental caries, which is another term for tooth decay. So I'll discuss a little bit about all of those, as well as in oral health during pregnancy, because it really starts there. It really starts with the expectant mother and things that she can do to make sure that she's not passing any bacteria on to her child. Also, I'll discuss the concept called medical dental integration, something that's very interesting and really gaining momentum in this day and age. And finally, I'll just make a little bit about a Points of Light project. Okay, next. Next. All right. So our oral health, some studies show that nearly 1 million Americans fail to see the dentist every year. That number always makes my heart hurt because I know how important it is to have good oral health. I understand that there are many, many reasons why this is the case. Mindsets, access to care, fear, there are all different reasons why people don't see the dentist. I think, and by the way, our current population for the United States is around 340 million. So that's almost a third of our population that don't see the dentist. Um, for me, understanding just how important it is to maintain good overall health by maintaining good oral health, I really want to see that number go down dramatically. A lot of people don't see the dentist because they can't afford it, and dental care is very expensive. If you make a certain income, you do qualify for Medicaid coverage in most states, which I'm really glad to see because it really has increased the access to care for people who ordinarily wouldn't be able to have it. But what I have found in all the years that I practiced dentistry is that we need to really work on changing mindsets about dentistry, just how important it is to our even our oral health. It's just how important it is to our comfort level. A nice smile can even impact whether or not we get a job. Some people that are missing teeth or have very decayed front teeth and present for a job may not know it, but I believe that there are many employers that may count that against them. So, and even in school, children, they can get teased. They'll tend to miss more school if they have a lot of cavities, and especially if they're in front teeth, and it even impacts their studying. So there are many, many reasons why people don't see the dentist but should. And so I'll be talking about that today. When I say that there's a bi-directional relationship between oral health and overall health, that means that dental disease can impact our overall health, and systemic disease, which is disease processes that occur in other areas of our body, can impact our oral health. And so I'll talk a little bit about that today. I love this term that was coined by the American Dental Association. It's healthy mouth, healthy body. Just that simple. So the dangers of poor oral health are tooth loss, gum disease. You hear me say periodontal disease. Periodontal disease is the same as gum disease. It's just a different, more technical term that we use. We've been able to link oral health to heart disease, diabetes, mouth cancer, respiratory infections, bad breath, which is pretty understandable, and even stroke and dementia. So I'll talk about that a little bit. Okay, next. So periodontal disease or gum disease is an inflammatory disease of bacterial etiology resulting from the loss of periodontal tissue and alveolar bone. Basically, all that means is that, first of all, inflammation, I believe, is the basis for many, many disease processes that occur in our bodies. And to say that it's a bacterial etiology just means that it is the basis of it or results from an overabundance of a certain type of bacteria. And the periodontal tissue is hard and soft tissue inside of our mouth. So that would include our gum tissue as well as bone, and even what we call periodontal ligaments, which are fibers that hold our teeth in our jawbone. I'll show you a picture in a moment to just give you a visual of what that looks like. Approximately 42% of adults with teeth in the United States over the age of 30 have some form of periodontal disease. And I think, 30 years old is pretty young to have gum disease because it's the number one reason adults lose their teeth. But even adults younger than 30 years of age, I have seen periodontal disease, and even in youth. We stage periodontal disease just like we would stage cancer. Stage 1 being the most mild form of gum disease, where you might have some gingival inflammation, some bleeding, some tenderness of your gums, and maybe a little bit of bone loss, but it progresses if it goes untreated all the way to stage 4, which you can imagine is the worst stage. And that's where you have, severe bone loss, usually a lot of bleeding, particularly when brushing or flossing, looseness of the teeth, and ultimately at that stage, the teeth have to either be extracted or in some cases, the teeth will actually fall out. So we don't want to see that. So that bone loss that we see is we see that on the radiographs. It's really the only way we can actually see that bone level. That's one of the many reasons why we take x-rays. And it can be mild, moderate, or severe. So, all right, next slide. So I'm getting a little technical. I'm a bit of a science nerd, so please bear with me, but I won't overdo it with the science. I think that it really helps you to understand, what really goes on in your mouth and in your body to see, some pictures. And so this is what we call a cross section of the lower jaw. That means like if we were just to take a knife and slice through the lower jaw and see a cross section, this is what it would look like. So the picture on the left, and this would be considered normal, healthy periodontal condition. You see the crown portion of the tooth, and that's what we see in the mouth. When we open our mouth, this is what we're brushing and flossing. That's the crown of the tooth, but the root of the tooth, which is the yellow portion, that is anchored in our bone. And it's held together by these little white fibers called periodontal ligaments that connects the root of the tooth to the bone. The bone represented here would be the yellowish mottled area, whereas the gum tissue would be the pink that you see. This would represent very healthy bone support. The majority of that root is encased in bone. And the more bone you have, the more stable your teeth are in your jaw. So the gum tissue, we want to see it pink. For darker skinned people, sometimes the gum tissue is brown, it's more pigmented, but we want to see nice, tight pink gums. And when I say tight, we want them to be tightly attached to the structures. You may see this little probe there on the right. If you go to your dentist regularly, your hygienist or your dentist will use a little metal probe to poke around your teeth. I know that's not really the most fun part of the visit, but what we're doing is we're measuring, they're little measuring devices in millimeters, and we're measuring the amount of attachment that the gums have to the teeth and to the roots. And we call that clinical attachment level. And then we're also measuring the bone level. And any number between 1 and 3 is good. 1 and 2 are really the best numbers. We know that there's no inflammation of swollen gums and there's no bone loss typically. And the attachment is really good and solid. So when you look over to the illustration in the middle, that would be a lower molar. Molars typically have more roots than the other teeth. And so on the left of that picture, that would be considered healthy gums. They're not usually that pink, though, maybe some are. And then the bone looks pretty good. So the majority of that root is encased in bone that would be healthy. But for that same diagram on the right, that is what inflammation looks like of the gums. They become swollen, puffy, tender. They're going to bleed when you're brushing and flossing. That's a sign of inflammation. And they begin to pull away from the tooth. Another thing that happens is you begin to lose bone. So if you look, that bone is resorbing away when there's gum disease. So when there's periodontal disease present, there's an overgrowth of a particular type of bacteria that is present on the teeth and in the gums and underneath the gums. And as the bone begins to resorb away, the gum tissue pulls away from the tooth, what we call a periodontal pocket forms. And our measurement device can measure just how deep that pocket is in millimeters. And you may see a little brownish area attached to the tooth. That's tartar. In dentistry, sometimes we call that calculus, but you are probably more familiar with the term tartar. Tartar basically will form if we're not brushing the plaque off of our teeth efficiently, or not, if we're just not brushing our teeth enough, and there's extra plaque on our teeth, which is a filmy, yellowish, not very attractive looking substance that forms on our teeth. And it even forms actually within 30 minutes after brushing. But if we're not doing a really good job brushing, more and more tartar builds up. And the calcium in our saliva will attach to that plaque, mineralize the plaque, and turn it into, it becomes calcified or hardened, and it turns into tartar. So once that happens, you can't brush that off, and you need to see your dentist or hygienist to have your teeth professionally cleaned, because the special instruments that we use will scrape that tartar off the teeth. And that tartar also has embedded in it a lot of bacteria. So now we've got this pocket that has this reservoir of buildup of bacteria that can cause not only inflammation, but infection, which is not a good thing. What happens is our body's immune system will detect that there's a foreign substance here, there's too much bacteria, there's something happening in this area, we need to go fight it off. And so the cells in your immune system will mobilize and they'll go to that area. and began to try to fight that bacteria and fight the tartar that's there. And what happens, so I always say that it's a war going on in your mouth. And the casualty of that war is your gum tissue and the bone that gets absorbed away, that gets damaged. You can't get that bone back either. And so it's very, very important. You hear prevention a lot in medicine and in dentistry. Prevention is everything. This is entirely avoidable, but it happens so often. All right, next slide. So we have been able, through studies, to connect periodontal disease with an increased incidence of stroke, diabetes, pregnancy complication, and bacteremia. Basically, there have been some studies that have suggested that treating gum disease may help prevent the development of arteries blocking, especially in your brain, thereby reducing the risk of stroke. Some of these studies have even suggested that patients with gum disease are twice as likely to develop a stroke caused by the hardening of the large arteries in the brain than those that don't have gum disease. Periodontal disease is associated with certain elevated or increased levels of proteins and other substances in the blood that are associated with inflammatory markers. What an inflammatory marker is basically these are cells within our blood that are associated with systemic diseases such as rheumatoid arthritis, cardiovascular disease, and even severe neurological deficits like dementia and Alzheimer's disease. So these inflammatory markers are detected through blood tests. There are so many things that doctors look at when they draw blood, and they look at these markers to determine, whether or not they can diagnose particular types of disease processes that occur from inflammation in the body. It helps them not only diagnose, but then determine like appropriate treatment for those particular diseases. And so what they're finding is that with periodontitis or periodontal disease, there's a strong association between stroke and these other conditions, and because they're sharing the same inflammatory markers. And I just want to say too that the way we treat periodontal disease is that we use our instruments to professionally clean your teeth. If the periodontal disease, if you have deep pocketing, sometimes we have to numb those areas and go deeper under the gums to scrape, the bacteria and the tartar off of the teeth. We place a patient on a more frequent recall for cleanings, 3 per year as opposed to 2 when people have healthy gums. And then sometimes we have to do periodontal surgery in order to smooth out the affected bones. So there's treatment that has to be done, but once again, with prevention and regular dental visits, that can be avoided. So I just want to talk to you just a little bit about cancer of the head and neck in particular. We're seeing really an increased incidence of particular types of cancer, oral cancer, and oropharyngeal cancer. When I say oropharyngeal, that's in your mouth and it's in the back of your throat. Okay. And so we're seeing a greater incidence of that. And you have to look at lifestyle. And then, of course, there's genetic predispositions as well. But so when I graduated from dental school back in 1988, I stayed in Chicago for a couple of years and practiced in a dental practice with one of my friends who owned the practice. And I think I was out of school for maybe a week or two. So this was one of my very first patients that I saw. When a new patient would come to our office, the standard protocol is, they fill out a very extensive medical and dental history form. Our assistant would bring them back, and I would review that medical history form with them, and then let the assistant take a full set of radiographs. And once those radiographs were completed, I would go back into the operatory, go over the health history form again with the patient, look at the x-rays, and then sit the patient back and do a thorough examination. When I was in school, we were taught to do an oral cancer screening exam. So we're not just looking at, the hard and soft tissues, the teeth and the gum tissues. We're looking under the tongue. We're looking at the tongue, inside of the cheek. We're, I'm what we call palpating or feeling the lymph nodes and the glands, where that's a part of our oral cancer screening exam. And this particular gentleman was a first time patient. He had not seen a dentist in a while. He was probably late 50s, early 60s, if I remember correctly. And he wasn't having any problems, no pain, no discomfort, didn't notice any changes anywhere. He just knew that he wanted to see a dentist. He heard about our practice and wanted to get his teeth cleaned and an examination and establish a dental home with us. So when I began this gentleman's oral cancer screening exam, I lifted his tongue and looked under his tongue, and I saw a large circular lesion. It looked like an ulceration. And sometimes we can get ulcerations for various reasons, but this one looked unusual. And so I felt it was very hard. I asked him, was it uncomfortable? He said no. I asked him, was he aware that it was there? He said no. Um, and so having just graduated from dental school and taken my boards, I knew what I was looking at. I knew, even though I didn't have a pathology report, that this was oral cancer and it wasn't small. And so I sat the patient up and I didn't want to scare him, but I just, explained to him what I saw, that it was concerning. Fortunately, we worked in an office building that had other healthcare providers. And I had just recently met one of the oral surgeons in that building. So I called his office and just called in a favor, because I knew he was busy and had lots of patients and surgery scheduled. But I asked if they see this patient right away. I did not want to wait. I didn't want to clean his teeth. I didn't want to do anything. And so they were gracious enough to accept the patient. The oral surgeon just looked and he knew right away that he took other special radiographs, and he also did a biopsy and rushed a path report. Well, unfortunately, it did come back as cancer. And within 2 weeks, that patient passed away. And that was, very jarring for me because, I had no history with him. And so, I didn't know if, did I catch this? I knew that it wasn't really early on because of the size of the lesion, but hopefully we can catch it in time, treat it. Hopefully it's localized and it hasn't metastasized or spread throughout his body, or, we can save this man. And so it was very shocking. And that just, lets you know that, cancer, first of all, we know can be fatal. And depending on where it's located, there's a higher risk of mortality than other areas. But it could have, I'm assuming that cancer was a metastasis from cancer that was occurring somewhere else in his body. It eventually found its way to the oral cavity. And so by the time I saw him, he was already in a terminal condition and didn't know it. But it's also one of the main reasons why, it's so important to see a dentist, because if it was, for instance, a primary lesion or originated in oral cavity, I saw it early, that could have changed, saved the patient's life. So next slide, please. So oropharyngeal cancers account for 2.9% of all cancers diagnosed in the United States. And it accounts for 1.6% of all cancer deaths. The 5-year survival rate for those with localized disease is 83%. And that means that the cancer is localized only to that area, your mouth or your oral pharynx, compared to only a 36% survival rate for patients whose cancer metastasized, which I know happened with this particular patient. Squamous cell carcinoma is the most common malignancy in the oral cavity and the oral pharynx, accounting for 90% of the cancers of the head and neck. So we have squamous cells that are like the outer, that are composed the outer surface of our skin. So many people have heard of squamous cell carcinoma of, the skin when they develop skin cancer. I think it's the second most common skin cancer. Basal cell carcinoma would be the most common skin cancer. So oftentimes cancers are named based on the type of cell, which could be, they start out as normal cells in our body, but then they begin to change and morph into cancer cells. And so the type of cell, it determines, oftentimes whether or not, this is going to be a more aggressive form of cancer or not. The most common risk factors aren't surprising for people developing cancer of the oral cavity or the oral pharynx, and that would be tobacco use, alcohol consumption, heavy use of alcohol and tobacco together, and also infection with human papillomavirus. That's a major risk for oral pharyngeal cancer, which is carved in the back of your throat. We're seeing an increased risk in this day and age of oral pharyngeal cancers. I've even personally known two dentists who suffered from oral pharyngeal cancer, and the treatment it's very difficult to treat, and just it causes all types of other issues. But prevention, prevention is key. Preventative measures, rather, is key. Next. So I'm going to just go over the signs and symptoms of oral cancer. And it's not for people to all of a sudden become paranoid or, to instill fear. I believe the opposite will happen, that, the more educated you are about your body, every area of your body, the less fear there is, and the more you can just proactively move to, get the help that you need, get the checkups that you need, and not wait or self-diagnose like many of us do. Throat pain or difficulty swallowing would be a symptom. A sore throat of over 2 weeks duration, rapid unexplained weight loss, a lump or sore in the back of your throat or mouth, a lump in your neck, persistent coughing, difficulty moving your jaw or tongue when you didn't have that issue before, numbness of your tongue or other areas of the mouth. And I want to say here that if you just recently had dental treatment that performed and you had an injection and there's numbness, that's normal, so it's nothing to be afraid of. And even for some people, that we call it paresthesia, that paresthesia lasts longer than others, but ultimately, it does wear off. And so don't fear that. If you just recently had dental work done, then, don't worry about that. But if you haven't, and all of a sudden you're beginning to notice that you're losing the feeling in your tongue or your lip or other areas of your mouth for no reason, I would go to the dentist first, even before your physician, because we're more trained at diagnosing diseases of, really the head and neck. And then also swelling of the jaw that causes dentures to fit poorly or become uncomfortable. So there are many people that are what we call edentulous, or don't have any teeth. They wear complete dentures, and some have partial dentures. Usually over time, when you're missing teeth in those areas, your jawbone will shrink and dentures will loosen up. And so after so many years, you would need to have new dentures made. But if you're noticing a swelling, that's not normal. And so I would say, immediately see your dentist. Okay, next. So I'd like to talk about dental caries, another term for tooth decay. Tooth decay is the destruction of your tooth enamel, which is that outer hard surface or layer of your teeth. If decay remains untreated for too long, then it can spread to the next layer of your tooth structure called dentin. Sensitivity or even pain may develop at this point. So when you're sensitive, something isn't right. And you should always see the dentist and not just wait for it to go away. Maybe, it's a fluke. No, if you become sensitive, make sure you see your dentist, because when we catch things early, the amount of treatment that's needed is far less aggressive. But eventually, if decay is not treated, it will spread all the way into the nerve chamber of your tooth, which is in the center of the tooth. And if decay spreads to the nerve, you're going to experience oftentimes, excruciating pain, as well as complications from infection. And I'll talk about that a little bit more. So if decay goes untreated for too long, then an abscess can form. And it was just a small localized area of infection. We can even see abscesses on radiographs. We can see them if we look in the mouth. We can see a little lump or swelling. But if that abscess isn't treated appropriately, in other words, the tooth isn't treated typically with a root canal, sometimes the tooth has to be extracted. But if that treatment hasn't taken place and you're not placed on antibiotics to take care of the whole situation, the abscess continues to form. You could develop what we call a cellulitis, and that's where your face will begin to swell. So it goes from being an abscess to spreading to the surrounding tissues, causing your jaw to swell. That is a life-threatening situation. If that abscess or if that cellulitis is associated with an upper tooth, then your infection can spread to your brain with fatal consequences. If the abscess is associated with your lower jaw and lower tooth, it could spread to your throat, cut off your air supply, causing death. Next. So I won't, belabor this too long. The picture but because it's not really that clear, so I apologize for that. But we have a healthy sound tooth on the left, but as we move toward the pictures on the right here, you can see little dots, excuse me, that's the beginning stages of decay, at least the one on the left. And the x-rays associated with the teeth are below. And so the x-rays will show us things that we typically can't see. We can't often see in between teeth. In this particular photograph, we can. So if I was looking in this patient's mouth, I could see a little dot right there in between the teeth. Oftentimes we cannot unless it's really large. And so that's another reason why x-rays are so important. We can see in between the teeth. And so there's a tiny little dark area there on the x-ray. So I know that I'm going to have that this patient rather would need a filling that would extend into the interproximal or, middle into the in between the teeth here. We call that interproximal area. As you move over, you can see darker areas here. That's decay growing. So this particular patient isn't probably seeing the dentist regularly, and if they are, they're not agreeing to have the dental work done. Sometimes we do have patients we'll diagnose, we'll tell them, hey, you need to get back to see me because these are the things that need to, we need to do, and they will stall, and sometimes they can't make it back, but a lot of times they just don't realize how important it is. So as we move over to the far right was this big, large, dark area of decay. This patient probably has some discomfort. And in the center of the tooth, the dark area there in the center of the tooth down lower is your nerve chamber. And once it reaches that nerve chamber, that's when bacteria can seep into the nerve chamber and then out through the tip of the root of the tooth into the surrounding bone, travel through the tissue and cause all kinds of issues. So I just want to tell you a little story about a little boy. His name was Diamante Driver. He's 12 years old, and he, in 2007, he died of an infected tooth. So basically what happened was Diamante's mother was a single mom, she had a very low paying job and she could barely make ends meet. And the situation was so bad that at one point, Diamante and his mom and his sibling were living in a homeless shelter. So even though they were covered, fortunately, by Medicaid, as a result of living in that shelter, their Medicaid coverage was dropped because the paperwork fell through the cracks. And I believe that probably what happened was, they didn't have a permanent home address. And so, that it complicated situations. And so they didn't have this coverage that they normally would have. So after many phone calls and help from friends, her Medicaid coverage was reinstated for herself and her children. But then she had a difficult time finding a dentist who saw Medicaid, who treated Medicaid patients. Back in 2007, in the state of Maryland, dentists participating in the Medicaid program were pretty sparse back then, and the wait time to get an appointment was months as opposed to days or weeks. And even if a person had an emergency. So on top of Diamante having some sensitivity, a little bit of sensitivity, but more so complaining of a headache, his younger brother had 6 decayed teeth that were all abscessed. He complained often of pain and discomfort. So his mom made, the difficult decision to, take his younger brother to the dentist first, which would seem to make sense. And Diamante would have to wait. So as time went on, though, Diamante's headaches became much more severe. Sensitivity in his jaw became more severe, more frequent, the pain actually. And so she took him to the hospital ER. And they treated him at the time. They gave him medication for sinus infection, headache, and dental abscess. Now, when you go to the ER, which you should if it's an emergency situation for sure, but when you go to the ER, you're going to see more than likely a medical doctor and not a dentist. And they're really trained to evaluate dental disease. So they're going to more than likely give you pain medication, antibiotics, but they're not going to treat the source of the problem. Now, most, if not all, hospitals do have oral surgeons that are on call, but they're not there all the time. And so the doctor did what he felt was best, but the source of the problem was not identified. So shortly thereafter, his pain grew significantly worse, and his mother rushed him back to Children's Hospital. At that point, they realized that he had a brain infection and they performed emergency brain surgery. Shortly thereafter, he began to have seizures. They rushed him back into surgery and performed a second brain surgery. They ultimately realized the source of his problems, and that tooth at that time was extracted, the infected tooth, which was the cause of all of his problems. So, unfortunately, after several weeks of extensive medical treatment totaling nearly $200,000, Diamante died. An $80 tooth extraction would have saved this child's life had he received the appropriate care in time. So basically, what happened was that bacteria from that infected tooth spread to Diamante's brain and caused death. And what I said before was the fact that if it was in the lower jaw, then that infection could spread to the throat, close up the airway, and also cause death. This underscores the importance of regular dental visits, getting proper treatment right away, establishing a dental home, having good oral hygiene, and a proper diet. That Diamante's case made national attention, and politicians and government agencies took note. Today, the Medicaid programs are significantly improved, and we're making great strides in improving access to dental care for the underserved population. I mean, Delta Dental is doing a phenomenal job making sure that, we reach those communities where there's underserved communities where people need, access to dental care. They need education about how important their dental care is. I think we have just a very robust Medicaid program here, at Delta Dental. Just doing such a wonderful job. Things that I didn't know until I started working for Delta Dental. I have very little knowledge about what the company does. I just saw them as being an insurance administrator of benefits, but I found out that, we're so much more than that. And that means a lot to me because this case always stuck with me. And anything that we can do as an organization or even as individuals to improve oral health for society is a plus. That is the most severe case scenario, but it can happen. So, just another reason why it's just very important not to wait. Okay, next. So let's talk about oral health during pregnancy. After all, this is where it all begins. Expectant mothers have a lot to think about during pregnancy, but one thing that shouldn't be on the back burner is their oral health. Your oral health is not only important for you, it's important for your baby. As I mentioned earlier, periodontal disease is linked to pregnancy complications. Two of those main complications are preeclampsia, which is pregnancy hypertension, and premature birth. Okay, next. So why is oral health important during pregnancy? Oral health is truly important before, during, and after pregnancy, but it is of particular significance during pregnancy for several reasons. Many of the reasons that we must give oral hygiene more consideration during pregnancy or revolve around the fact that there are hormonal changes that occur as a result of pregnancy. Without hormonal changes, rather, pregnancy would not be possible. So hormonal changes are good, but they can have somewhat of a negative side effect. A few of them, actually. Hormone changes that occur during pregnancy can increase expectant mother's risk also of pregnancy gingivitis, pregnancy tumors, which sounds scary, but they're really not so. Dry mouth, we call that xerostomia in dentistry, but it's just another term for dry mouth, which increases our risk for developing dental caries or dental decay. And then acid erosion, which leads to the wearing away of our enamel on our teeth, which also can cause an increased risk of cavities or dental caries. The good news is, with proper care during pregnancy, these side effects can be managed and even avoided, and optimal oral health can be maintained. Next. Okay, so let's look a little bit more closely at each of these possible side effects, their cause, what to look for, excuse me, and how to prevent or manage these symptoms. First, let's look at pregnancy gingivitis. So pregnancy gingivitis is an exaggerated response of the tissue to plaque and tartar. So what does that mean? When a woman is pregnant, excuse me, when a woman is pregnant, there's an increase in the circulating levels of hormones, estrogen and progesterone. If the oral hygiene is lacking and plaque and tartar are left to build up on the teeth and not removed regularly, then the tissue will become irritated and inflamed. So as we know, as I mentioned earlier, this occurs under normal circumstances in the absence of pregnancy. But during pregnancy, that increased circulation of hormones will exaggerate the response, and gingivitis can occur more easily. And I noticed in my practice that my expectant mothers almost always had pregnancy gingivitis. So I just cleaned their teeth an extra time during their pregnancy. If they normally had healthy gums, then they were on a 6 month recall where they're getting their teeth cleaned every 6 months or twice a year. But I always saw them an extra time because it happened with almost all of my pregnant patients, even when they were doing a good job at home. So just like any form of gingivitis, pregnancy gingivitis will manifest clinically as red swollen gums that might bleed when you brush and floss. This can occur in a small localized area like you see in this picture, or it can be generalized, and that means that it occurs throughout the mouth. And I always saw it in generalized. So I just clean their teeth, just gave them an extra cleaning. The gums, when they're in this condition, as you can imagine, are typically very tender to brush, which can discourage people from brushing their teeth if they have this condition. But if gingivitis is not properly treated, then the more advanced periodontal disease can develop. So it starts out as gingivitis, and then if gone untreated, we'll move on to mild periodontitis, moderate periodontitis, and all the way over to severe periodontitis if it's not treated. So despite the role that increased hormone production plays in the development of gingivitis for pregnant patients, this condition can be avoided completely. The best way to avoid or prevent this condition from occurring is just with regular dental care during pregnancy and meticulous home care, which I'll talk about in a little bit. Okay. Next. So dry mouth. Some women do report an increase in the experience of dry mouth during their pregnancy, and this can be associated with the body storing or retaining more water during pregnancy, as well as with frequent urination. As I mentioned earlier, a dry oral environment can increase the risk of cavities. Under usual circumstances, saliva serves to keep the teeth clean and free of food debris. When the mouth is dry because the salivary glands aren't functioning as well, so that food debris can collect and the plaque can form more easily on the teeth. And the plaque, of course, as I mentioned earlier, can ultimately mineralize and harden and turn into tartar, which you can't remove with your toothbrush, but you'd have to see a dentist or hygienist have that removed. So one of the things that you can do to combat this risk of caries, developing caries or cavities, is drink plenty of water and just sip it throughout the day. You can choose sugarless gum, sugarless only, or gum with the xylitol, that sugarless gum. When we're chewing gum, it stimulates the salivary glands and saliva will flow more frequently. You can also use a saliva substitute. Oral Balance is a gel that you see in this picture, and that's an example of a good saliva substitute, and it's a great remedy for dry mouth. Biotene is just one brand. There are many others out there. And they also have a mouth rinse and gum that are specifically formulated to combat symptoms of dry mouth. You can even find Biotene on Amazon, which is not surprising. I actually saw where somebody could buy a tiny home on Amazon. So I don't think there's anything you can't buy on Amazon these days. But the good thing is that it's easily accessible and it's not, a prescription isn't required, which sometimes is a bit of a barrier. Okay, next. So many expectant mothers also experience morning sickness during some portion of their pregnancy. Some mothers even experience morning sickness throughout the entire duration of their pregnancy. And in addition to being awful in every other way, morning sickness throughout the entire pregnancy, or any time rather, could also have associated with it vomiting, which is very hard on the teeth. The vomit contains stomach acid that softens enamel and can cause acid erosion. And so our stomach acids are so super strong. It's just amazing because enamel is the hardest substance in the human body. And that's why forensic dentists can actually, and this may be a little bit morbid, but with plane crashes and other disasters, sometimes people can only be identified through their dental records because in their teeth, the enamel oftentimes will remain intact. So it's very strong, but that just shows how strong our stomach acids are, that they can erode that hard substance. And if your enamel softens and is eroded, then it becomes you become much more susceptible to that decay invading the underlying tooth structure and just making its way to the center of the tooth where the nerve is. Um, to combat the possibility of acid erosion, it's recommended that you immediately rinse your mouth after vomiting with plain water. Or you can use a mixture of baking soda and water. Baking soda is really the best choice as it will work to neutralize the stomach acids which damage your teeth. So, if baking soda is not available, just rinse with water. The thing that you want to avoid, and this may seem counterintuitive, but you don't want to brush your teeth immediately after vomiting. You're going to want to wait an hour, at least an hour after vomiting, to actually brush your teeth. Because if you brush your teeth immediately thereafter, those stomach acids are there and you're actually etching those acids into the enamel, causing more harm than good. Okay, next. So, I will, just discuss some oral health recommendations. For those of you who see your dentist regularly, you're probably very familiar with these. But I always like to inform people because, I'm talking about, different types of dental disease, the main ones that occur and just how severe they can become. But I do want you to know and to be educated about how to maintain good oral health. Another thing I wanted to mention too that I didn't mention before is that we have bacteria all throughout our body, friendly bacteria that we're supposed to have to maintain what we call balance or homeostasis in our body. And surprisingly, probably to most people, we have more bacteria in our mouth than any other area of our body. And so if that balance is disrupted and that bacteria overgrows, it can just cause so much harm as we have seen. Okay, let's move on. So some oral health recommendations. Um, Brush your teeth twice per day with a soft toothbrush. And that always surprises people because, they do make medium and hard bristle toothbrushes. And people are like, well, if they make them, I mean, why are they, if they sell them, then obviously, we should have a choice. But we have learned, and we've known actually for a long time that the softer the bristle, the better you're removing the plaque from your teeth. And I always give this analogy. If you have jelly on your counter and you take a scrub brush and you try to remove that jelly, you're just going to really disperse it. It's going to just turn into maybe a thin film, but it's still going to be there. But if you take a soft cloth and wipe up the jelly, then you're efficiently removing all of it. And the same with plaque. It's the soft sort of gooey substance that forms on your teeth, but it can be very efficiently removed with a soft bristled toothbrush. Hard and medium bristled toothbrushes can cause damage to your teeth and gums. You can brush away your gum tissue and that will not come back oftentimes. And so your gum tissue will begin to recede. And you can actually brush away some of your tooth structure. And that doesn't grow back. And so then you would need to have a filling place to replace that missing tooth structure. And if that happens too, by the way, you're going to have a lot of sensitivity in those areas because you have tooth structure that was covered with tissue and bone that is now exposed, and there are nerve endings there. So sensitivity and even sometimes pain will develop. So you can actually cause a lot of destruction. So if you have medium or hard bristled toothbrushes, you don't have to throw them away, but just use them to clean your tile. But don't use them to brush your teeth. Always recommend a fluoride toothpaste with tartar control. What type, it doesn't matter, whatever your preference is. If you floss at least once per day. And it's so funny, I was sharing this the other day, but when I was in practice, the hardest thing in the world for me to get my patients to do was floss their teeth. I could get them to agree to full mouth extractions, root canals, you name it. But if I tell them you have got to start flossing every day, I know you're not flossing. They just, oh my gosh, they would rather give their right arm. I don't know what it is about that little piece of string, but a lot of people just don't, even if they're really, really good brushers, and even if they see their dentist on a regular basis, they're really good about everything except the flossing. So I've even had a lot of people say, I can't get in the back. I'm just not good. I don't have that manual dexterity. So, is it okay, Dr. Dale? So if I just floss my front teeth and go? And I said, okay, do I have to floss all my teeth? And I said, no, you don't have to floss all of your teeth, only the ones you want to keep. So that always would get them. But, the bottom line is no matter how well you're brushing your teeth, you're not that tooth, the bristles cannot reach in between your teeth or the interproximal areas. And so bacteria is building up there. And so you're going to have to use that floss to remove it. And there's a proper way to do that. Your dentist and hygienist should go over, some instructions with you as the proper way to brush and floss your teeth, actually. So, but yes, that's very, very important. Once a day for me really isn't enough because I floss after I eat anything. It's just I can't stand for anything to be in between my teeth or on my teeth. And so it becomes really a good habit. If you get into the habit of it, you'll get to the point where, you will want to floss. You're going to keep it, in your pocket, in your purse, at work, keep it in your car. Just like always have floss with you. You should visit your dentist at least twice a year for cleanings and periodic exams. I can't stress enough how important those exams are, just, mentioning the patient with cancer. But there are so many things that we can detect. Early detection is everything. But even with a normal, healthy mouth and gums, you should have your teeth cleaned twice a year because even when you're doing a great job at home, for most people, a little bit of tartar is going to build up and that has to be removed with our instruments. You should see the dentist to have your teeth cleaned at least 3 times a year if you've been diagnosed with periodontal disease. Call your dentist right away if a dental emergency occurs. But if you have an emergency and it's after hours and you can't find any dentist, then and you're forced to go to the ER, then do so, especially if your face is swollen, because that is dangerous. Do not delay treatment if dental disease is diagnosed. Don't just put it off. No, I don't feel like doing this. Can I just get it done on my next recall? I used to hear that a lot. And I'm like, no, let's just do this now because we don't know if it's going to spread more aggressively with you than maybe the next person. Everybody is different. So let's take care of this now. You'll need a smaller filling than if you wait. You may need a root canal, a core, or crown. You might need to have that tooth extracted. I mean, there are all these things that can happen if you wait too long. We always recommend that the first dental visit is for a child is by age 1. By that age, they're going to have a few teeth, and we can just see if they're coming in properly. If they let us, we'll and next slide, please. If they allow us, we can even take X-rays. Most of the time, they don't. So oftentimes we'll sit them in our lap and just see if we can just see in their mouth to see if there's a few teeth that they have if they're decaying. They actually can be, even at that age. And also we can just see if there are any other abnormalities that could be addressed early on. So oftentimes, babies that age, they'll cry. And even then, when they're crying, their mouth is wide open, and I can just get in there and look real fast with my mirror and my light, just see if I can see anything. So usually it's a very cursory exam. It's not extensive, but it serves a lot of purposes. Number one, I can just assess the growth and development from a dental perspective of that child, and also if there is anything wrong, we can address it right away. But also, it gets the child used to seeing us. Often when they're brought into the operatory, well, they have different reactions. Every child is different. Some, they see my mask, they see the white coat, and they just start screaming. Of course, a lot of adults do that too. So, but for sure with the little ones, and they're holding on to mom or dad. But sometimes they're not quite sure. And so, I won't put the mask on right away. And I'll just talk to them. And, then I'll put my mask on and sit them in my lap and just talk to them and play with them. We have little toys and things we can distract them with and just try to develop a little rapport with them. Sometimes we can't get past that. That's it. That's all I can do. No exam. But it gets the child used to the dentist. It gets them used to coming to the office, recognizing you, being comfortable with you, starting to trust you. So there's a lot of reasons why that age 1 dental appointment is so important. What we know for sure is that the earlier a child begins to see the dentist on a regular basis and sees the dentist regularly, the fewer problems they have throughout their lifetime. From a dental perspective, and we're finding out even from the generalized health perspective. So it's very, very, very important. Just some little tips. Introduce a sippy cup by 6 months of age. You can stop bottle use by 12 months of age. No bottles or sippy cups in bed. No juice the first year of life. Juice has a lot of sugar. The acids in the sugar break down enamel, causing decay. Healthy snack choices promote a lifetime of, a lifetime of healthy habits, basically. So, some parents will give their children a sippy cup with milk or a sugary drink and put them to bed with it, or a bottle. And this is never advised because the acid from the sugar in these drinks break down the enamel of their teeth and cause baby bottle caries. And that's just where, when they're sitting there with that bottle, and then the juice or the milk is just like pooling in their mouth, just sitting there in their mouth, and it's just destroying the enamel after so long. Baby bottle caries is basically, we see rampant decay throughout the mouth, usually very severe of most, if not all, the baby teeth. This is devastating for a child. Sometimes they have severe pain. The teeth typically require major restorative work, which has to be done, it should be done in an ER, or if it is done in office, then that dentist is trained and equipped to provide usually general anesthesia, so that the patient is sedated so they can do the work. If the decay is too extensive, sometimes all of the baby teeth need to be prematurely extracted. And that's a problem. You may think, well, they're going to have, their permanent teeth eventually, but the baby teeth are there for a reason. They help to chew the food properly, which improves assists with our digestive processes. Our front teeth we use to bite off food with. I mean, we need our teeth. And so, just in terms of overall health for the baby, 1 year is definitely that sweet spot in terms of when to take them. And once again, prevention is everything. So we're going to see things early on. And if we can prevent issues from happening, then we're happy. The baby's happy, the mom and dad are happy, we're happy. Okay, next. So I just want to talk very briefly. I know we're getting near the end here. Thank you so much for your patience and your time. But I want to talk about this concept of medical dental integration. I gave this presentation to the Michigan Orthopedic Association at their annual conference. And so I'm speaking to medical doctors and talking to them about, not only the connection between oral health and overall health, but, how we can integrate our efforts for, the good of patients. But, this concept is actually really becoming more and more popular, and they're even beginning to teach it in some of the schools, some nursing programs. I know there's one in, I think, New York, might be New York University. But what I would love to see happen one day is the, course on medical dental integration for dental schools, medical schools, and all other healthcare providers. So let's move on to the next slide. So medical dental integration consists of various practice models where the medical and dental professions can collaborate and coordinate care for various patient populations. In the medical dental integration model, coordinated and streamlined communication between the oral and systemic environments is critical to ensuring a patient's entire care team is aligned. So by us sharing information, dentists with physicians, nurses, physician assistants, and vice versa, and working collaboratively in a systematic and sustained manner, medical and dental professionals and integrated practices can identify these disease precursors and underlying conditions so that we can provide the absolute best outcomes for the populations that we treat. And there are different practice models with medical dental integration, some where they are in the same physical structure, the same building, the physicians and the dentist. And so the patient will have an exam with one and then be referred to the other. But there's also what we call electronic health records. They're communicating with each other via these electronic health records. There's some pros and cons associated with that, but that way the medical doctor can see, some of the dental records which is pertinent to, what they need to know. For instance, we know that there is a connection between periodontal disease and diabetes. So if the medical doctor has some of the dental records and they see that this patient has been diagnosed with or treated for periodontal disease, then they're going to maybe even just do a more involved evaluation of that patient to see whether or not they do have diabetes. But because we know that there is a strong connection there. And I believe the inflammatory markers are the number one reason why we can make that connection. But it just makes a big difference. And so then also the medical or the dentist can perhaps, it can help for sure the medical doctor by providing information and letting them know that, hey, this patient also has these particular issues as well, so you might want to check for this. And so there has to be this coordination of this training, which tends to be a hindrance because there aren't really a lot of training programs out there, but staff would really need to be trained on how to integrate these two types of practices and how to when and how and to whom to refer. But it is something that definitely is beginning to take place. So then we also have the models where you're in your own practice, you're in your separate dental practice and in a different building, the physicians are in their practice, but we rely upon each other to refer. And even before I understood this concept, I always had a really good relationship with the medical doctors in the communities where I practiced. And maybe it had a lot to do with just the fact that I understood that connection between the mouth and the body. But also my roommate at Michigan ended up becoming a physician. And I have to say she is brilliant, one of the best physicians I've ever known. And she's my best friend. And so we're very close and we talk all the time. And, I learned so much from her. She learned so much from me. And so I always kept very clear and consistent lines of communication open with my patients' physicians. But also I learned that the physicians are beginning to understand how important oral health is and how it impacts the patient's overall health, because when I was still practicing, medical doctors more and more were referring patients to me. Even if the doctor didn't know me personally, maybe they just heard about me. And the patient wasn't a patient of record in my office, but they're like, you need to see a dentist. And so they would tell me, well, my medical doctor said I need to see a dentist. So I thought that was amazing. If more physicians would do that, we could have this collaboration, integration of care that will ultimately result in greater outcomes for the patient. So that is a very important concept that I think that more research definitely has to be done. We're finding that it's helping, but there are some barriers that need to be overcome that I think with more practice, they can. Okay. So I just want to end with the next slide, which is, talking about the Points of Light project, which came about many, many years ago. Pediatric dentists, decided to start this referral process. And, I'm really glad that Delta Dental, as well as the Dental Association and other foundations are, sponsoring the Points of Light project. It's really a referral. What we're finding is, first of all, we know that the earlier the child sees the dentist by age 1, the better their outcome for their oral health and overall health is throughout their entire lifetime. But what we're finding is, of course, there are fewer pediatric dentists than there are general dentists. And many general dentists aren't comfortable treating children. And I can understand that. I thought, when I was in dental school, actually, that it would be such a challenge. I was afraid. Like one of my first patients as a dental student, when I was first released into the clinics, was a 1 year, no, she was 1.5 years old. And guess what? She needed a root canal. And not only that, she didn't speak English and she was screaming and crying. I mean, I was like, oh my gosh, when I get out, I'm not going to see children. Well, I had to go get my instructor and I'm like, I'm going to need a little help with this one. And so he spoke fluent Spanish and he was able to talk to the child and calm her down just a little bit. I was actually able to do the work. So I thought, oh my gosh, am I going to flunk out of dental school for my first patient? But it actually worked out very well. And, I had so much compassion for that child. When I graduated, I thought, I'm not going to not see children. I love kids and I love keeping families together. So if I can see everyone from the baby to grandparent, I'll do that. But it's nice to keep them in all one practice. But sometimes that's not possible. And if a small child cannot be controlled, or if they need really extensive work done that really should be done all at the same time under sedation, then I would refer to a pediatric dentist. Well, the wait was long. And so these children needed this work done, and it was hard to get in to see these pediatric dentists. And so this referral process was created to where they would reach out to all the general dentists in the county. Okay. And they're like, would you be willing to see children? Do you see children in your practice? If you do not, would you be willing to see them? Would you at least be willing to do a 1-year exam, we called it? In other words, do an exam on a 1-year child, 1-year-old child, even if you have to ultimately refer them somewhere, get them in and do that 1-year exam. And so, if so, then let us know. We'll put you on our list. And so we got really good responses from that once the word got out. And there are a lot of general dentists now that are on this list. And so, there are pediatric dentists and general dentists willing to see small children to at least get them started. And, parents can go on this website and, find out, like, because the demographics are there. So they'll find out like where the dentists are located in their area, who sees children, and then they can call those offices and set up appointments. So anyway, it's simple, but I thought it was ingenious actually. And it's once again improving access to care. We have lots of dentists just waiting to treat patients, but there are a lot of barriers to the access to these dentists, and anything that we can do to improve that, could not only create healthy smiles, but possibly even save a life. So thank you so much for your patience. And let's just go to the last slide there. If you don't have time to ask questions today, this is my email address, my phone number. I'm available to answer any questions. But thank you so much for your patience and your time.
Thank you so much, Dr. Dantzler. This has been an amazing presentation, and we actually did get a few questions in the chat, so I'm gonna just go through them. So the first one says, hi, Dr. Dantzler. You've been talking about dental health during pregnancy. Is there anything that menopausal or postmenopausal women need to be aware of or focus on?
Well, what a phenomenal question. We have seen in menopausal and postmenopausal women, because of that hormonal change and imbalance, an increased incidence of inflammation, gingival inflammation. I've not seen anything severe, but I have seen that. And so I would recommend, as with everyone who is more at risk for gingivitis and periodontal disease, to brush more often, even than normal, floss more often than normal. And if you have any issues that you can't resolve by doing that, make sure that you see your dentist. The dentist might want to clean your teeth more often too. That's an excellent question.
Yeah, thank you. And we got another question as well. Is there any way to reverse receding gums?
Unfortunately, no, not naturally. I mean, we can do, I should say, well, in general, no, but for those dentists, particularly periodontists, become specialists, they can do a gingival graft for some people if they are good candidates. And that means that they're going to take some tissue from one area and then overlay it in the area where you're deficient. So we can't physiologically grow gum tissue back, but through surgery and under certain circumstances, you can have a periodontal flap surgery, we call it.
Great, thank you. So those were the questions that we got. I just want to thank you again so much for, oh, we got another one. What is
Okay.
your opinion on water flossing versus traditional flossing? Can water flossing replace string?
It cannot, but the water picks are good. They are good. There are, good adjuncts to our normal, routine that can help, but it doesn't replace, because we got it. The floss is really the only thing that can slide in between those teeth. So yeah, it's a good question.
Thank you, Jessica. Does anybody else have any other questions as we're wrapping up? All right. right, it looks like we are through with our questions. I want to thank you so much again, Dr. Dantzler, for being here and for presenting this wonderful presentation on oral and overall health. I know it was very informational for me, and I know that our guests, seeing as how many questions we have in the chat, found it engaging as well. I want to thank our wonderful sponsor, Delta Dental, for helping us put this on today and for all the amazing work that we do. And I hope that everybody who joined us today found this informational and enjoyed joining us today, and that everybody has a great rest of their Wednesday.
Thank you so much.
Thank you, Dr. Dantzler.
You're welcome. Thank you.